Are there side effects for the game-changing drug Ozempic that are serious? What are the top 4 most common side effects from taking the drug? Ozempic or semaglutide is a medicine used to treat elevated glucose levels in people with type 2 diabetes. In addition to a healthy diet and exercise program, it can also help you lose weight. Here, we look at 4 essential side effects of Ozempic. Some side effects are more common than others. Luckily, the most common side effects are usually short-term and only last a few days or weeks in most people. We'll offer tips on recognizing and managing these side effects so you can stay on treatment and meet your goals. Side effect number 1. Stomach, abdominal side effects with GLP-1 agonist agents like Ozempic are common, but tend to be mild and clear up in a few weeks in most people. Stomach side effects can be more common with higher doses. The most common side effect of Ozempic is nausea, which occurs in about 15% to 20% of people. 7% experienced vomiting, 8% of patients experienced diarrhea, 7% had stomach area pain, and 5% had constipation. These side effects occurred at rates higher than the placebo-treated groups receiving an inactive treatment. In general, patients may report higher rates of gastrointestinal side effects. More patients receiving Ozempic 0.5 mg and 1 mg respectively discontinued treatment due to side effects at this dose. However, this is not the prescribed starting dose of 25 mg for a once-per-week shot and is not regularly given to patients outside of this study, even for those who get the drug and experience side effects at lower doses. The good news is that for most people, these side effects are mild and temporary and will not interfere with long-term treatment. They typically subside within a few weeks of starting treatment. Stomach side effects usually occur at the beginning of treatment, and when your dose is increased too quickly. Because of this, your healthcare provider will slowly increase your dose every 4 weeks as needed until you reach your target dose. You can take Ozempic with or without meals. Consider following these tips to help you manage stomach side effects when you start Ozempic. Eat more slowly, consume smaller meals, select more bland, low-fat foods like crackers, toast, and rice, and avoid greasy fried foods or sugar treats. Eat foods that contain water like soup or gelatin. Don't lie down right after eating, drink clear or ice-cold liquids, and if possible, go outside for fresh air if you feel sick to your stomach. Does Ozempic cause an ileus? In September 2023, the FDA updated a side effect called ileus, an intestinal obstruction, in the product label for Ozempic and other similar medicines, Wegovy, Rybelsus, and Mounjaro. These side effects were voluntarily reported after Ozempic was approved, so the FDA cannot reliably determine how often this side effect occurs or if the drug caused the side effect. An ileus is an intestinal blockage that prevents the intestinal contents from passing through the gut. It doesn't involve a physical blockage. An ileus can lead to problems with the muscles or nerves found in the intestine and interfere with normal muscle contractions. Symptoms of ileus may include stomach area, abdominal swelling, distension, fullness, gas in the stomach area, abdominal, pain and cramping, breath odor, constipation, diarrhea, inability to pass gas, or vomiting. However, it is important to note that there is no single well-documented case of this occurring as a direct correlation to semaglutide. If you experience stomach side effects with Ozempic that bother you, worsen, or do not go away, call your healthcare provider immediately for further evaluation. Side effect number 2. Eye conditions are common in those who have diabetic history, but does Ozempic make these conditions worse? What about people who have no diabetic history and are taking it for weight loss? Diabetic retinopathy is a serious eye disease that can lead to blindness. People with type 2 diabetes and long-term, uncontrolled blood sugar levels are at higher risk. In retinopathy, blood vessels weaken and leak blood into the surrounding tissues, leading to inflammation. Over time, this results in new blood vessels obstructing the retina, which can lead to blindness. Risk factors for developing diabetic retinopathy include having diabetes for more than 5 years, poor blood sugar control, high blood pressure, high cholesterol, pregnancy or kidney disease, smoking, eye surgery or other eye problems, and a family history of diabetic retinopathy. Rapid improvement in blood sugar control, as may occur with Ozempic, has also been associated with a temporary worsening of diabetic retinopathy in some patients. In an Ozempic clinical study, more patients receiving Ozempic had diabetic retinopathy. However, 99.5% of these patients had a diagnosed history of diabetic-related vision problems. The effect of long-term blood sugar control with semaglutide on diabetic retinopathy complications has not been studied. Before you start Ozempic treatment, it's important to tell your healthcare provider if you have a history of diabetic retinopathy. If you experience any vision changes while using Ozempic, contact your doctor for further evaluation. Maintain regular vision checkups as recommended by your doctor. Your eye care professional or doctor should monitor you for progression of diabetic retinopathy. The good news is, there are no known elevated risks of vision impairment for those who don't have a history of diabetes to date. Side effect number 3. Your thyroid is a small gland in the front of your neck. It makes and releases certain hormones, which help control many body functions. One of the most serious but rare warnings with Ozempic includes a risk for thyroid tumors or thyroid cancer, which has been seen in animal rat studies. It is not known if Ozempic will cause thyroid tumors or thyroid cancer in humans, but it carries a boxed warning for this possible side effect, the FDA's most prominent warning. Do not use Ozempic if you or anyone in your family have ever had a type of thyroid cancer called medullary thyroid carcinoma, or if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2. Other semaglutide products and all GLP-1 receptor agonists also carry this warning. Cases of MTC have been seen in patients treated with another GLP-1 receptor agonist, liraglutide, Saxenda Victoza, after it was approved by the FDA. However, it is not known if liraglutide caused these tumors because the reports needed more data to conclude. Your doctor will check your thyroid gland, found in your neck area, for nodules. A blood test, serum calcitonin, or a thyroid ultrasound and imaging test may be used to monitor for thyroid disease, but this is not commonly done because the tests are not very specific. However, if your doctor suspects thyroid disease, they may order these tests and do further evaluations. If you notice any of the following signs or symptoms, contact your doctor right away. A lump or swelling in the neck pain, a hoarse voice or voice changes, trouble swallowing, trouble breathing, or a cough that won't go away. Side effect number 4. So what is the number one most concerning side effect of Ozempic that is commonly reported? It's shocking because it falls under too much of a good thing. The risk of hypoglycemia with GLP-1 receptor agonists like Ozempic is low, but may still occur. Low blood sugar, if it occurs, can be a serious side effect of the Ozempic treatment. You may be at a greater risk for this side effect if you also take other drugs for diabetes, including sulfonylureas, for example glipizide or glyburide, or insulin. Higher doses of Ozempic may also increase your risk for low blood sugar. In 30-week-long studies, when Ozempic 0.5 mg or 1 mg dose was used as the only diabetes treatment, low blood sugar with symptoms occurred in 1.6% to 3.8% of patients taking Ozempic and 0% taking a placebo, inactive treatment. No severe hypoglycemia was reported with Ozempic monotherapy. When Ozempic is used with insulin, hypoglycemia can occur, and a dose reduction of the insulin may be needed. When Ozempic 0.5 mg or 1 mg dose was used with insulin, with or without metformin, low blood sugar occurred in 16.7% to 29.8% of patients taking Ozempic and 15.2% taking a placebo. Severe or documented symptomatic low blood sugar occurred in 8.3% to 10.7% of patients and 5.3% in the placebo group. 1.5% of patients receiving the 1 mg Ozempic dose reported severe low blood sugar, and none in the other groups. When Ozempic is used with a class of diabetes management drugs known as sulfonylureas, there is an increased risk of complications. Severe hypoglycemia occurred in 0.8% and 1.2% of patients when Ozempic 0.5 mg and 1 mg respectively was co-administered with a sulfonylurea. Documented symptomatic low blood sugar occurred in 17.3% and 24.4% of patients when Ozempic 0.5 mg and 1 mg respectively was co-administered with sulfonylurea. Severe or blood glucose-confirmed symptomatic hypoglycemia occurred in 6.5% and 10.4% of patients when Ozempic 0.5 mg and 1 mg respectively was co-administered with sulfonylurea. Low blood sugar has also been reported in patients taking GLP-1 receptor agonists who do not have type 2 diabetes. Ask your doctor what it's important to do if you develop symptoms of low blood sugar. This may include taking glucose, sugar tablets, a glucose liquid, or fruit juice. You and your doctor may need to monitor your blood sugar more closely during treatment with Ozempic. Tell your healthcare provider if you are taking other medicines to treat diabetes, including sulfonylureas or insulin. Ozempic slows down your stomach emptying and can affect medications that need to pass through your stomach quickly. Your doctor may need to change your dose of certain diabetes medicines. This is not a complete list of Ozempic's side effects or warnings. Other important side effects include disease of the pancreas, gallbladder, and kidney, and serious allergic reactions. If you have questions or concerns about side effects, contact your doctor immediately. You should review all Ozempic side effects in more detail with your doctor. You can also review the manufacturer's medication guide and discuss this information with your healthcare provider. The bottom line: Ozempic, semaglutide, is a prescription medicine used to treat high glucose blood sugar levels in people with type 2 diabetes. In addition to a healthy diet and increased activity, it's also approved to reduce the risk of major adverse cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes and known heart disease. Common side effects like stomach-related nausea, vomiting, or diarrhea can occur but tend to be moderate and temporary, improving after several weeks of treatment. Other side effects, such as those of the thyroid, pancreas, gallbladder, and kidney, low blood sugar, or allergic reactions, tend to be less frequent but can still be severe or even life-threatening. It's important to learn how to recognize the signs and symptoms of these potential side effects. Your doctor may need to adjust your doses of other type 2 diabetes medicines. Tell them if you take a sulfonylurea medicine or insulin, do not exceed the dose of Ozempic prescribed by your healthcare provider, as this may increase your risk for more severe side effects. This is not all the information you need about Ozempic semaglutide for safe and effective use, and it does not replace your doctor's directions. Review the full Ozempic information and discuss this information and any questions you have with your doctor or other healthcare provider. Did you enjoy this video? Like and subscribe for more Weight Loss Warrior Zone.